I, I.
All right, everybody. Aloha Monday. Don't forget. Don't forget, guys.
Yeah.
We got a heck of a show tonight, people.
Don't forget, it's blank night today. Blank night.
Hey, where am I seeing here? Why is this thing not happening here? Okay.
Yeah.
Yeah. Okay. Here we go. We got the people on. We got the camera going. Let me just make my thing here. Share. Tonight's message is going to be an important message from none other than Dr. Scott Miscovich, who has pretty much been on the front line from early on. And he's got some possible solutions or options, I should say,
Mm-hmm.
for us as we go forward. So I haven't spoken to him except for a very short text. But I think we all got a ton of questions, and I got to tell you though, and I'm gonna wait a little while because I want as many people on as possible. I don't know if you saw the governor's interview with the Star Advertiser today.
No, I didn't. How was it?
You know, we've been very critical, and I got criticized, and I continue to get criticized. Not personally, but the comments in the post that we were all against uh, the governor. Now we love him. Listen, we give credit where credit is due. We will. This has never been and never will be personal. It just isn't. So when I am critical of someone because I may not agree with their position, it's not personal. If that same person says something which, in my opinion, is in the right direction, in my opinion, then I recognize them for that. It's not personal. If it was personal, I wouldn't say anything good about anybody that I had an issue with. But it's not the case. Charlie and I, it's so funny because we talk about this a lot offline about some. Let me just say this: we will recognize the efforts of our leaders, whether it's positive or negative. If we believe that our leaders are doing something that is positive for the people, we will recognize that. I saw that post. It was from a friend too, man. I was like kind of hurt in a part of me was kind of hurt because I know it was directed to me, and it was kind of like it's almost like the Super Bowl post. You see, oh, everybody hated Brady, now they love him. No, man, you don't have to be a fan of Tom Brady to recognize the fact that he's a damn good quarterback. Nothing is personal. So anyway, so today on the governor's interview, they asked him a question about the lieutenant governor's position on opening up travel with this once you complete the second vaccine. And the governor said that that was an irresponsible thing to say. That was an irresponsible thing to say. That until we know, and he made it very clear, his commitment was to the science, and that he was going to wait for the science. And then they asked him later on. There was another question from the viewers that were watching live. What was his position on the lieutenant governor's comments about opening up gatherings like weddings and other large gatherings after the second shot? And he repeated the same answer, that it was not a wise thing, that in fact it's dangerous. So Charlie, I don't know why I didn't call you right away. I was busy today, and but I was working and multitasking, so I had the feed going live, and I heard the question, and then it got my attention. But the governor has made it very clear that we are going to wait for the science. He made it clear that Dr. Fauci and that the CDC and everyone else is saying that we don't know. how effective this vaccine is against catching or spreading the virus. We've beat that done. I'm curious to see what Dr. Miscovich is going to say. I'm sure his line of discussion will be along the lines of testing, but we'll see. We'll see.
Well, I think, I would say this, and that is, if there was a very, very dedicated and strong impact investigative group that did the contact tracing, and I'm not saying there isn't, but it's just that it hasn't come to the forefront yet. But if it started from back when, and we had a very powerful contact tracing group, that we could show the people of the state of Hawaii that when there's a report of a outbreak, okay, whether it be one, whether it be 10, and they can get to it right away and they can determine, okay, we know how it came in contact with the infected person. Infected person came in contact with somebody that just arrived in, that, and we're making checks with that person branching out, and whether it was based on a contact that was made at the airport here in Hawaii or a contact made somewhere on the mainland. However it is, if we had that in place, we could be recommending all kind of things and everybody would be confident. I'm sure of that. But we lack that confidence because we've seen firsthand what kind of program we have. And I'm not saying all of them are bad. It's just that even I get, even like in my business now, when I do an investigation now, I get real hard on myself if I just missing that one key element. I lose sleep over it. I'll call the missus and say, honey, I'm gonna stay out late because I gotta question this witness and I gotta get the answer. But like they told, like they tell you back as a recruit, there are just some things, no matter how hard you try, you won't get the answer. That's just it. So then I know then you just don't go and make up one answer because you won't get caught. You don't get caught with your tail between your legs and you're gonna be history. You're never ever gonna be able to do another investigation.
Yep.
But it's
Oh, you're
just
right.
that with this whole contact tracing program, I just felt like it just didn't go enough. And a lot of people felt the same way. It's like, come on, man, we with you. Come on, push harder. Let's go. You need help? Let's share some of the information with us. Maybe there's somebody listening to the program that can drop a dime on what's going on. You know what I mean? Like, oh yeah, that victim that is infected now, he was over here, and there's a bunch of other people now calling in sick because we all work together. You know,
Yeah.
something. But because everything is so secretive, nobody can share information to begin with. And that's a sad thing about it. That's a
No,
sad.
it is, man. And that's kind of like what we've been doing and talking about for a long. That's what I mean. Like for us, Charlie, and for our viewers that come on every night, I'm
Yeah.
surprised sometimes that they keep coming on because the topics don't change. We all, every so often we'll surprise you all with something different, but we believe that it's so important to talk about.
Yeah.
And I was at work today, and my partner Paul was listening to the the governor's interview, and he was saying that the reason why we as a people, all of us, all our viewers and those that are very active and engaged on Facebook and other social media platforms, these guys listen. They actually hear, whether or not they take action on what we as a people are saying. The fact remains that they actually hear us. They hear it, whether they listen or not. That's another story. But we cannot stop. We simply cannot stop because we are in some right now some challenging times because you got the health portion, right? You got the part where we want to keep everybody safe. We don't want nobody to die or get sick. And then there's the economic part where we don't want people to get destroyed because the economy is down. And that's the balance that we expect our leaders to do, but or to find. But we what we as a people see is a focus that has always been from day one has been on the visitor industry. And now we talking about variants. We're talking about um, new strains that may not respond to the vaccines or treatment. And you know, we because it's in South Africa or it's so far away, I think we can try to convince, that we meaning our leadership, convince ourselves that maybe it's not so dangerous and maybe it won't get here. Well, it's here. The genome sequencing that we're doing, we're not doing it on every single positive that we get. It's done randomly, according to the state lab guy. He said they're doing randomly throughout the island. So we're getting a snapshot of what's actually going on, but you know, it's a difficult thing, and we got to stay engaged and active so so they know that we're listening and we're watching and we're holding them accountable. That's what this show does. That's all what you guys do on your own with your posts, because Charlie and I, we get all the posts, we see it all. We may not respond, but we see it all, and that is collectively is what's making changes. um, we really got to focus our energies on getting the message out. And this is just a vehicle. You know,
Let
our
me,
show is just a vehicle for that.
let me just say this. Let me just say this one thing, and that is because, and you hit the nail on the head because of the variant. The variant is basically a change in the present virus. Something happened to the present virus. One of those spikes got a little bit altered. That makes it different. And so that's the variant. So now it's sort of like that Japanese show, Godzilla.
Yeah.
We went for a long period of time. We just dealt with when Raging Bull, like on Bullfight, that thing got out of the arena and was just running down the road like a Raging Bull. Now all of a sudden with this variant, we get Godzilla just appear on our shows. What the heck you gonna do? And that's why I said, what is so funny is that there are other things that happen in life. There's like Fort Knox, for instance, gold, right? They have that surrounding the protective shield. If something happens there, there's still another location, right?
Hmm.
But what was funny with this virus is when it involved the economy, when something happened, it came on complete shutdown. It's just like the plan was, I don't think anybody would expect it to do a complete shutdown. It would have done, I think the way everybody talked in the beginning was just a minor pinch, a minor inconvenience. And so now when this thing had gone way beyond the timeline, everybody started to get worried. And the only resolution they could come to was like, it just open up already,
Yeah.
right? I don't blame them. I don't blame them because that's common. I mean, I probably took that same attitude, just open up already. But then I thought to myself, but what if we got something that's going to hit us harder than the initial wave? How do we deal with that? That's what started to play on my mind.
Yeah.
Is it possible that something so bad that's going to be even that packs a punch even harder than the first go around? To the point that okay, you open up fine, but hey, if nobody gonna travel, what you gonna do? Yeah, if nobody alive to enjoy to enjoy what we have here, what you gonna do? And so there's a lot of those things that just over and over again, it's repetitive. But I don't blame anybody for being pissed off because they want to get back to it. I don't blame nobody. You have the right,
Absolutely.
but there's all these other different things that go along with it too. Because remember when they opened up and they had to shut down, open up again and shut down? That's the thing I was worried about is how many opening up and shutting downs can everybody take, right?
Hup, hup,
Yeah, he's,
10 hut,
yeah,
10 hut.
Hi,
yeah.
guys.
How you doing, Doc?
What's
Good.
up, Doc?
Can you hear me?
Oh, loud and clear, loud and clear.
What's that?
Yeah, just Mel's hearing aid is not working right now, but I can hear you loud and clear.
Great, great.
Welcome
Thanks.
back, Doc. Welcome
Thanks.
back, man. Again, I got to tell you, we've been having these celebrities come on our show. It's like flattering for us. It's wow. All these big shot CNN kind of guys, and I mean,
No,
we've had some celebrities, man. Thank you for spending the time with us again, Doc.
no, you guys are the big shots. You guys are my heroes. So don't worry, buddies. Don't worry. You know who the guys that are making a difference are. So you're my heroes.
Well,
I'll give you credit.
Charlie's big and I'm short. That's the only big short we get is Charlie's big and I'm short.
And
Well,
we're not heroes, Doc. We're Oreos.
oh
Hey,
no.
for those of you that don't know, which I don't think there's anyone on our show, but this is Dr. Scott Miscovich from
Medical
Premier
group.
Medical Center or Clinic.
Medical group, premier
Medical
medical
group.
group.
Ooh, yeah,
Yep.
group. Yeah, it's big. It's big. It's huge. But Premier Medical Group, as I was explaining before you came on, has pretty much, Doc, you and your group has been pretty much in the front line from day one. I mean, from when we didn't know much uh, till today, you've been there on the front line and have a very good understanding of what's going on and so maybe we can just start with take a few minutes. Give us the history and a real brief history and where we were and where we're at now and what we can look forward to or what options are available for us. And there's just a lot of questions, a lot of questions.
Well, do we have till tomorrow? I could talk about this all day, all night, and keep on going. Um, yeah, well, I'm just with Premier. I'm just so proud of my organization and all the people I have with the organization because they're the key. I can try to give the leadership and the vision, but without these people putting their lives on the line every day, it's hard. And I'm estimating that probably when I hit March, I'm going to have over 1,000 employees, which is kind of crazy for me to even imagine. And we're already in about 20 states. But again, Hawaii is our heart. Hawaii is our home, and big presence on the Big Island. And we're very proud of everything that's happening over there with the multitudes of partnerships. And I'd like to say a shout out and welcome back to work. Mayor Mitch is back at his desk today after an unfortunate heart attack and is doing well, and he's been great to work with. And then Oahu, we're still really going strong and doing everything we can on Oahu. And you guys have seen it. Look at the numbers across the state today. I know it's a little bit of a counting glitch today where, we'll probably have some uptick and it's the way the numbers are reported, et cetera. But I do think that there's a solid downward trend that we're starting to see right now. So from my perspective, I've been asked this question already. Are we going to see a post Super Bowl boost from people getting together? I think we'll see a little bit of an uptick, but I still have a lot of faith in our people of Hawaii that they were smart enough to not go crazy and have big Super Bowl parties. And so in general, we need to be proud of ourselves. The state of Hawaii is top in the country. We're number one by a long shot. No one's now even close to us with how well we're controlling the COVID. Hospitals, admissions, ICUs, everything is much better. And man, you guys know how many times we've been on this show where we were just right at the brink and we were just right on the edge. So I do believe that we have a lot to be thankful for. The people need to take the credit for what's going on. You guys and all your leadership and a lot of the people you've had on get to take credit. But in general, I think we have to smile at where we are, and yet we have a few little warning signs out there that we have to be careful of. But I'll stop at that and see how you guys are doing.
Let me ask you something really quick, Mel.
Yeah, no, go ahead. Go ahead.
You hit the nail on the head when you said that everything shows a downward trend. Now, just by how we as loving people of Hawaii, we have a tendency of when we see certain things happening, we just go for broke and celebrate. See, that's the part I'm scared about because Why don't you tell our viewers, you see this downward spike, but the thing is, it shows that we're doing something right, but there's not a length of study that's done that tells us, okay, we are definitely out of danger because it hasn't happened long enough, right? Am I correct? That downward spike?
Um, Yeah, guys, it's way deeper than that. We have the little darkness and the little unknown that I wanted to mention
Mhm.
is the variance.
Right.
And we know we have some variants already in the state of Hawaii. And in general, most of us who are kind of on the front line studying this are quite certain that understanding the infective nature of the B117, that it's probably going to be coming up. The estimations were by April, it was going to probably cross over as the predominant strain where we're going to see. That might be a little bit early, but it's likely going to be. We now know it's 30, 50, 70, minimum of 30% more contagious. And it's probably at least 50% more contagious by most of the best estimates. And by fact that it's more contagious means that more people will get it and it can be more lethal. Now, but it's the virus itself is not more lethal. It's just the fact that more people would get it, which would increase the lethality and the death rate from it. Now, that's the little side that everybody needs to start thinking about and not letting their guard down and not thinking they can toss their mask or go pauhana and, or start thinking about going to bars because the bars will probably eventually start opening. So that's the big concern. Now, what's the positive? The positive that balances that out is the fact that we are, we're in the upper third in the country with now where we stand with how many vaccines have been put into the first arm, and middle of the pack with who's gotten two and who is getting the vaccines, but the 1Bs and the 1B2s, the 1Cs are coming. And that means these are the nursing home first responders over 75. Now, with the new variant being more predominant and the amount of disease we have, what does that mean? We're going to have less death, plain and simple. We're going to start seeing less people can potentially die from it. Doesn't mean no one can die. And it doesn't mean if you're 35, you can still die from it. And that's what the young people need to understand, who are the most rapid growing group is still the 18 to 35 to 40-year-olds. That's who's spiking across the country. The people who think they're immortal, but they're going to be bringing it home now to their 50, 55, 60, 65, 64-year-olds, and those people can still die. So, so that's the balance we have right now, guys. It's black and dark on one side. Now, God forbid we get the South African variant coming through or the Brazilian variant, plus the other 8 or 10, there's other variants that are out there. These are the ones that are just more studied and have been, have prevailed more. And that's another misnomer is people think, oh, there's these 3. Now, these variants have been occurring. It's just these 3 have risen up. And in the true survival of the fittest are the ones that have become the most viable to live and spread. Others come across and they die. And they don't spread and replicate. And that's what's scary about virology and variants is that they're variants, and God forbid, we don't want a mutation. That's what we don't want.
Hey, Doc, I got a bunch of questions, but let me just start off with how much testing are we actually doing now? And I'm not talking about pre-travel testing. I'm talking about how much testing are we actually doing in the communities to identify our positive cases. I do not, I just don't see the testing being done. I know it's not being done here on Kauai, unless you get sick and you go to the doctor or possibly through some contact tracing. But are we doing any type of testing throughout the state?
Yeah, that data is available, and I could, when I get a chance, I'll pull it up to you guys and I'll email it to you later. But it is available through there is a type of website you can go with the Department of Health, and you can dive down by county, and you'll see by county, and then it's going to have the number of tests that are done, number of tests that are done monthly, and then it's going to give you the number of tests per capita, right? And so there is a wide variety of things. I mean, you guys have the pros and cons. I think the pros, because you're doing so well, of having the lowest number of tests per capita. But then again, you've had the best data. So so that's one thing. Now, Maui is picking up because they've kind of run into a rough spell. Over in the Big Island, we have actually done more testing over there than any of the islands per capita, and we continue to do testing. And that's, again, I'm obviously a little partial because I'm running with the county all the testing over there, and we have the 4 types of testing. We have regular community surveillance testing. So every Saturday in Hilo and Kona, you just know you can count on a drive-through and you can just go, there's no questions. And then we have it Waimea, and we have it all over. So we have regular surveillance testing that's available throughout the island, which I think is crucial. Then the second thing we have is cluster testing. So we've had a couple clusters over there. One was up on a coffee plantation with some immigrant workers, and we were there within 12 hours. We tested almost every 3 days. We're into 2 weeks in, and we're down to 0. We didn't really have a whole bunch of complications. We're close to 0 with that. Then we have the high-risk communities. So we have the homeless shelters, we have the communal living, we have some of the Pacific Island little areas where people have clustered together. I said public housing, and so we're doing those on a regular basis. So that's another group. And then finally, we have pop-up testing in really remote areas, because our belief is everybody needs opportunity to test. So I don't know. I don't think Kauai is having that type of approach, but then again, you guys have had wonderful outcomes. I know Oahu is, and Oahu pretty much just relies on the fact that you have an emergency room, you have an urgent care, go seek it out. So and they don't do that.
As far as Big Island, where can people go? Because I'm seeing the comments that a lot of people are not aware of the testing. Where can they go to find out where these testing sites are and how they can get there and get tested?
County website has them all listed. They have them all listed every day, all over. You can find, like today, we had 2 or 3 locations. On a Monday, we were in very remote locations, about 3 different strike teams out there. And then, the regular community tests for Hilo and Kona at least every Saturday. And then Waimea, I think we're up there every Wednesday. And, they're just all over. And the county website will have all of them. And
these don't require a doctor's paper or anything like
Nothing.
that? Anyone can just show up, drive through, get tested, and get the results.
Right. And Mel, let me make a comment just as a generality, which is kind of a positive thing. One of the data pieces that we look for is called the percent positivity. The percent positivity reflects what percentage of your tests that you're doing on a given day, the incidents, are positive. And like, for example, if we went across the Southwest or, some of the areas of the South, they got 17, 20, 25%. Now, when you look at that percent positivity, it's always been a number I've talked about as one of the most crucial tests to determine testing. In a perfect world, when you start getting down below 4% and that arrow is going downward, that means that you're starting to do enough testing to detect the number of positives in your population. When you start getting down below 1%, your disease is shrinking and it's going away. When you're up at 15, 20, 25, basically the standard in epidemiology is that means you're not doing enough testing. That if there's 15, 20, 25, that means there's probably double that number, or 50%, who have the disease, but you just have not given them enough access to get the testing done. So by and large, I believe the majority of our state, although it's being offered in different ways on each island, has been testing adequately, especially in the past month or 2. So I think we're in pretty good shape with the number of tests. And I think it's pretty available, but my feeling is you shouldn't have to seek it out. It should be in your face, and you should know where it is.
Exactly. I mean, I just quite alarmed by the few comments that I saw that people have no idea. So check your state, your county's website for the information, and go get tested if you want to get tested.
Yeah.
There's this um, something that was put out, and we both Mel and I had received a lot of calls about this. That pertains to the opening up for travel related coming to the state, especially from South Korea, where they're looking at no quarantine, and you get a pre-test and no quarantine, or you get a pre-test and you have vaccination, and no quarantine. But who knows? They're coming in from South Korea, for example, right? And yet the turnaround from here go back to South Korea. They're requiring, they're mandatory. They're making them do a 14-day quarantine. What's your take on that? I mean, are we asking for trouble by? I mean, I don't. I think a lot of it has to do with, again, the industry trying to ramp up the economy. But what use does is it if we're gonna just flop right back on our faces again? We're just gonna be in the same boat. I mean, what's your take, Doc?
Well, guys, this is good for us to talk about. It's a bigger philosophic question for me. I'll give you a specific answer, but I want to dialogue a little bit on the bigger philosophic question, and that is how do you make a determination? We're fortunate because we're an island state. In Georgia, they can't say something, you just drive right in. Other states have border control, but they can still probably take a train in or something. But we're in a very unique situation. Uh, how do we make a determination of which countries can be let in, right? What is the determining factor? What do you guys think is the determining factor? What are the determining factors? Other countries, whether it's Europe or other areas, are saying that one country can come in. How do we go from the closed COVID world to an expansive world? Um, if I'm making a decision, what I am having to do is I'm going to be looking at the data from that country, and I'm going to be looking at the numbers we just talked about, the percent positivity, the trends, what kind of testing, is available on a daily basis. I'm going to be studying my visitor bureau information. Who are the types of people that are coming and visiting here? What are they coming for? And I'm going to make a comment that is kind of based on some experience, and that is, I think the South Koreans are beautiful people, super intelligent, super technologically advanced, strong ties to the state of Hawaii. Their healthcare system in South Korea is fabulous. It is world class. And as a generality, when I start putting the factors together, looking, because I did look at the data, when I saw the South Korea stuff come out, I was like, wait a second, where'd that come from? And then I dove into the data, and I was like, well, wow, they're one of the top countries in the world on how well they're controlling. And then the other thing I would say, I have two other ties. Number one is when I started to study and approach how I was going to recommend testing in Hawaii, I studied the South Korea model because they basically kicked butt at the beginning. They were the leaders to show what was going on. And then I think we have a shared friend, which is Dr. Kim, who is brilliant, and he's in the front lines over there. So I think if there's a country in the world right now that I'm okay with, I think I've just listed a whole bunch of reasons why, very specifically, I'm fine with South Korea at this point. And then my question would be, do we take the same type of analytical approach and make it country by country? That's what, I don't know what you guys think, or I don't know what you think about my reasoning or not reasoning. And obviously I don't have a say in it, but man, I've got a lot of respect for what's going on over there.
Well,
I think for me, the CDC recommendations are very clear. I think even Dr. Kim on our show, and even in email communications subsequent to that, Dr. Kim makes it very clear that traveling is just not a good idea. That in fact, even with the vaccine. And that's the whole big issue right now. I heard the governor on his interview today with the Star Advertiser, where he was asked about allowing people to travel uh, after completing 2 vaccines, and you know, even the governor said he's just going to wait until the science determines that it's safe. Right now, the CDC and every expert I know of is saying the same thing, that we should not, number one, we shouldn't be traveling unless you have to travel. When you talked about country by country by country and positivity rates, I think that's critical. But even within our own country, we are having people fly into Hawaii on a single test from states that have very high positivity rates, which again, I ain't a doctor or a scientist, but that tells me that's probably not very safe. And in fact, the variants that are popping up now, and I'm not sure what percentage of positive cases we're actually doing the sequencing on, but the fact that we're really not screening. We have one test, and I think we had this discussion a long time ago, Doc, about the one test system is really not a very good process, because there's so much that can happen from days before you take the test to days after you take the test. So how do we get around the CDC recommendations, and keep everybody safe, and also save our economy? That's the tough question.
There you go. There you go. That is the question. And Mel and Charlie, what I'm going to say is, you know, in early times, I was looking at that and I was like saying, well, I'm going to be cautiously looking at this one test, but yet on the other hand, I really did a deep dive because I'm really into the data and I study every big organization's recommendations. And you know, I have some beef with the CDC. The CDC under Trump was, as we're finding out now, was being manipulated. That's the new data that came out. But remember, the CDC only gives recommendations. It's not a hard and fast body. And you know, one that drives me crazy is we are living with the CDC saying social distancing is 6 feet. Well, it's recommended to be a minimum of 6 feet. And it's up to, you know, the individual. There's so many little things in there that the CDC is trying to make decisions for an entire broad country that we have to be careful with how we view CDC. Now, generally, I think I like the new people. I think we're going to get a lot better shake out of it. So in general, let's always keep that clear when we talk CDC. Let's never absolutely say that it's 100%, nor is 100% here for Hawaii. We are different. We are different right now than the rest of the United States. We are in a whole different situation. So I think it's really important that we always look at it, accept it for what it is as a recommending body that's recommending for 50 various states across the country that are in various phases of recovery, and it's doing the best it can. So that's one. Now, on the other hand, from my perspective, I did start out saying, what about it with the first test? I know the science, I know exactly what the incubation is. I could draw it, spell it. I've done this all over the country. But there's a lot of human factors that we didn't put into play. And that's why I think we have successfully proven in the Big Island that the one test system with the arrival test has worked wonderfully. Guys, look at what we're doing on the Big Island. We have daily arrivals, 1,000 to 2,000, and hotels are open, restaurants are open, bars are open, and we have, 3 positives? Our positivity rate over the last 14 days is 4.5. We've had no deaths. And why? Okay, what is the difference? I think part of the difference is we are not paying attention to who is traveling right now. It's not science and it's not a statistic. There are very specific people who are traveling. And these are people that I'm finding from being on the ground that are interested in getting away from COVID, that are not coming to enjoy bars and restaurants. They're going for seclusion. They're going for nature. And we had this discussion, I think, last time I was on the show. The Big Island and Kauai probably share that a lot. Maui and Oahu probably may have a little more of a subsegmented group who want to go and have a good time and are trying to get the cheap plane ticket and find a cheap hotel and go, whoop it up. But I think that the Kauai and Big Island travelers, in my mind, are Big Island, since we're October 15th and now been wide open, it's a huge success with one test, with one arrival test. We have had so few travelers that have spread the disease. And the question is why? It's probably because of the type of people who are choosing to come during a pandemic. I don't know any other way to say it, but I know there's a huge feeling of optimism, and the number of people coming, especially at this time of year, is fairly significant for what we expected on the Big Island.
Doc, let me ask you this on Oahu. Let's take Oahu, for instance. They're continually having numbers show up. Where are those numbers coming from? I mean, they don't have drive-through testing or those kind of testing programs right now on Oahu, right? You're not doing anything like that there. So these numbers are coming from what? Someone seeking medical attention?
Yep.
And that's the reason why?
Yep. They're probably coming. I know I have an urgent care over in Kaneohe, and we'll get positives all the time coming out there. People are coming symptomatic. And, I'm going to give you some anecdotal things. They're not going to give you the big picture, but there was a lot of post-travel where people went on quote unquote vacation or went to see family, and they went. And even though they did get their post-return tests, some of those people converted positive. And so that was happening. And I'm telling you guys, this is something that bugs me a little bit. And that is that this broad essential worker category that we have, where people can pop in and out and fly in and out because they have an essential worker and they get exempt from the same oversight. And I think that is a secondary source of infection that's occurring. It's what, 22% or so, or in the 20s of all travelers, and they don't have that. And yeah, granted, these people have important jobs, but I think everybody should be getting tested and following all the testing protocols. And especially now with the number of people that have the disease on the mainland. So.
No, and then the only reason why I asked that is, sometimes you kind of get to the point where you're like, okay, if it's here and it's not getting over a certain number, I don't know if we're prepared to handle, I saw one comment that, and it's not about COVID-related deaths, but we have deaths that are not COVID-related deaths because they just didn't have a bed to go to and they ended up dying, one of those thoughts. And if we were to have a major outbreak, I mean, we all understand on the early onset, the contact tracing program still needs to be tweaked. I mean, I don't care what anybody says. It's, if you can't find it, it's travel related. Then the only other assumption is community spread. I mean, come on, Della. I mean, did it just, somebody went outside with a water can and watered it a couple of days and boom, then you got a positive. So I'm just wondering, and in your opinion, as one who dealt with this so many thousands of times setting up programs around the nation, are we prepared that if we get a major outbreak, especially with these new variants, and this thing suddenly takes off on us, can we slow it down?
Well, okay. So the first thing I have to say is, I believe we did have a major outbreak. When you look at the spike we had in our numbers, we were really getting close. I mean, I was in close communication with people throughout our major hospitals. We really, really did get close. So if you look back at that time when we had that high peak, we can't go much higher than that. All right. So
if we took those numbers when we had those high peaks, would the lab be able to test to see if a variant was during those high peak periods, or the samples that can't be used?
Okay, I can give you 101 because I just talked to an AP reporter because they were asking me whether the SEC was testing for the variants. and they were trying to make a big outbreak to say that, why are we not testing? Okay, so when you're getting your test, you're getting a PCR test. PCR does not test for the genetic sequencing. PCR just tests whether you have COVID or not. So what has to happen then, and what's happening in our state, is some of the positives that are going to the labs, most of them diagnostics and clinical, certain ones will just randomly get sent to the Department of Health, and it will go into their lab and they'll be genetically sequenced. That's how we found the two of them. Now, there is a technical way with a technical machine that some of the ones have, that if they run it on its Roche TAC path and they get what's called an S dropout pattern, it could give an inference that there is a new variant, and that should be sent off. Now, that's being done in numerous labs across the country. But when you talk about sequencing, that's like 23andMe and Ancestry.com. You have to get the whole pattern of the 30-some thousand, I think COVID has, different sequences to look at to see where it is. And there's numerous other variants that are present, let alone the 3 that have just risen up. And so the bigger picture for me is the United States is dismal. The CDC is finally picking up more, but we are so far behind on genetic sequencing that it's ridiculous that, we have no clue. The fact is that this is probably so much more broadly spread throughout the country. We don't know. And my guess is, although I give credit to our DOH, they're doing more sequencing probably than other states, we're still far, far short of knowing what we have. Just remember, guys, most of us are going to estimate April, June, at the latest, but April likely mid across the mainland is going to be more of the predominant, about 30, 35, 40% of the cases are probably going to be the variants. It's going to be here.
So, from an investigator standpoint, and I'm being very generic about this, I would think at that point, if our highest peak was like 300 something cases, right? We had at that one time. And first of all, I would go look and see if we still got any more samples lying around from that period. Is that safe to say? Am I on the right track, or it can't be done?
No, it could be done, but if you go back to the original B117, it was found in the south of England, down around Kent. It was really first early discovered in October, and then started to peak up. And then if you look at the first 2 weeks in December, it started to spread. And I have to smile, because I have the CNN time, and I'm on CNN, and this one anchor is always kind of looking for these kind of aggressive things. And they play this statement by Governor Cuomo of New York. They started out, and Governor Cuomo is saying, we got this variant over there, and it's so much more contagious, and we're not even testing, and those people can come right into the country, and we do no testing, and we need to do something about it. And then they stop the interview, they stop the clip, and they say, Dr. Miscovich, do you agree with Governor Cuomo? And I said, well, I do agree with one part of it, and that is that we should be doing testing before people coming in. But one thing I really disagree with Governor Cuomo on is that it's way too late. These people have been coming in, infecting our country for months. So we're far too late. And sure enough, that's been the case.
What data is
it's too late. It's too late for most of these cases, right?
Okay, so what data is available to say that when we hit that spike in the summer or whenever, when we hit that 300 mark, right? What's available for us to say, okay, that's our peak, but that probably wasn't a variant. Have we seen any peak on a variant infectious transmissibility yet, or we have?
Oh, well, yeah, England, if you look at the data from the first 2 weeks in England before Boris Johnson shut it down, I mean, it went like this. It's scary. If you really want to see, to answer your question, Charlie, go look at England's data. And it goes like this, and it starts to creep up slowly in October, then November goes up. And all of a sudden, when the variant becomes the predominant thing, it goes in 2 weeks, it's almost a vertical line in a 2-week period. So it really was a massive change, and that is what you're talking about, and that's what we have to look at. And I still think across our United States we need to do more genetic analysis, especially with the lethality that we know that the South African variant has, and then the Brazilian variant as amongst the others. So what you're saying is correct. We should have studied those. We should see. There is a lot of phylogeny. There's a lot of genetic analysis that's going on all over the world. But is there enough? No. And that's what your answer, that's what the real answer is to your question. No. And we need to do more. Do we need to invest more in it? Hell yeah, we need to. But guys, one of the things that goes back to, what do? Mask, social distance, right? Be prepared. You know, nothing's going to change for what we need to do. Test, test, and test. We have to do it. So, yeah.
Hey, Doc, have you heard? Somebody just asked this in the comments about the D614G variant. Are you familiar? I have not heard about that one at all.
I don't know all the numbers. I've read about most of them, but if the person wants to give an acronym associated with it, where it's coming from, yeah, that would be good. There are the 3 main variants that we know of, but there's about another 5 that are starting to rise a little bit that are concerning, you know, and so I know them more by some of the alphanumeric with the location. So.
Okay. I know we got 20 minutes left, and the time with you goes so quick.
I'm sorry, I hog cheese. I hog cheese.
No,
Okay.
that's not hog cheesing. It is what it is. You know, the information is valuable, and we appreciate it.
Thank you.
One of the things I'm really afraid of, the hospitalizations, because I know when the press releases come out of the state, the governor's office or lieutenant governor's office, they mention that we're doing so well with the hospitalizations, but the numbers that they release are numbers that are COVID patients in hospitals. When I look at the report that I get from a source that shows the percentage of vacant or open ICU beds, we're not that well. I mean, yeah, Maui was 100%. A majority of the hospitals in the state, and it's broken down by hospital, was about 60% full. So while we may not be full with COVID patients, the ICU beds are full with non-COVID patients.
I would always be concerned about neighbor islands because we do not have ample number of beds for neighbor islands to handle even minor surges. And right. And so I think you are bringing up a valid point. The valid point is that just in general, it's what I was saying from the day at the beginning, and you guys were the champions of, we don't have the luxury of having open beds. There was a point when we were doing a lot of analysis on the internal basis. It started to get spread where we were looking at the surgical centers and turning them into ICUs and the same day surgical centers at the hospital, because what they have is they have ventilators in there, they have the lighting, they have the equipment. So there were secondary options because we were getting so close that we were building in. But as a state, except for Oahu, where we have a little more luxury of the number of beds we have with our bigger hospitals, man, oh man, neighbor islands cannot afford it at all. As we've seen in Maui, man, Maui, I'll tell you, it's just not been a good thing. And, you know, guys, I got to stand up and say, how can we let there be a hospital over there that's had so many positive outbreaks now within the hospital itself? You know, Queens had a little small one quickly taken care of, but all the other hospitals, you guys haven't had any in Wilcox, and even I went over and did the one at Kona, and there were 2 or 3 people, and we shut it down. There was no more. It was staff, never went to patients. But in Maui Memorial, it's going through the staff, and then it goes into the patients, and it goes wards multiple times. That's worrisome for an island that doesn't have a lot of beds or a lot of capacity and has one hospital. Very worrisome.
Yeah, and the overflow will end up on Oahu, and
Oh
I
yeah.
think that's so. The concern is really a statewide concern, and I think that's why Kauai, especially, is very concerned about the travel policy because it could turn us upside down really really quick, and that is I think what's on a lot of people's minds, and I know the legislature is trying to take away the mayor's authority. We're not going to get into that. We're not going to get into political discussions. But the fact of the matter is that Hawaii has done well because some extra restrictions that we have, and and we're afraid. I mean, with 9 ICU beds, you don't need 9 COVID patients to fill the beds. I mean,
Yeah. Yeah.
so
Well, guys, I have one thing I wanted to make sure I wanted to get out because your forum is so well spread, and these are some of the. I like to just kind of speak the truth to people and give them an idea of things that aren't being said. And big thing is vaccinations right now, right? We know what's going on. We're doing okay with getting vaccinations out there. But I want to give people just a reality check on vaccinations. Okay, so we know, like, for example, I'm fortunate I got Pfizer. Pfizer's so good so far. It's holding up against the variants. The Moderna, well, they're a little concerned, not quite as active against against one of the variants, the South African. So Moderna is making a third shot. That if you got that one, they're going to try to give you a third booster that will make it broader. And then we're hearing that, like, we have the new vaccine that's just coming out now, single shot. But you know what? 50, 60, maybe going up to 80%. Okay. Would I recommend getting it if it's your only chance? Sure, because what it's going to do is probably reduce the likelihood you're going to die and go into the ICU. And then we had another vaccine that just came out, like, for example, was it Merck? They just shut it down because theirs just didn't pass any of its clinical trials. And there's literally over 200 more trials that are going on. Most people have no clue that there are 200 vaccine attempts that are going on in the world. And these vaccines are being processed by 11 different vaccine types of reactions. The messenger RNA is the first one, and then the second one is the adenovirus. There are 11 different ways that they're making these vaccines. Think of the math on that. Think of that. So what we're going to see, and this is what the people of Hawaii and America needs to understand, the world needs to understand, is there's going to be winners and there's going to be losers. There's going to be vaccines that are going to come out of this, and so far, like, for example, I got the Pfizer, but I don't know if 6 months from now, the immunity that you get is going to go down. I don't know if it's going to go up. No one does at this stage. And so there are going to be ongoing discussions, and there are going to be vaccines that are going to be given to people that are probably not going to be effective as over a very short period of time, and they're either going to be boosted, or more than likely they're going to be switched to the winners and the vaccines that are showing more effectiveness. And I know you, me, and our families, we're Americans and we have the best healthcare system in the world. We're going to demand the best. And if we find that, Sputnik 1 over there in Russia is better than ours, well, we're going to want to find out a way where all of America can get Sputnik 1 or can get some other new one that's coming, because that's what we're going to want. We're going to want the best coverage we can. So what people need to understand, the vaccine is not the panacea, right? The vaccine is one of the steps in this process. And we have so much to learn about which one is going to be the proper vaccine or not. And my recommendation is get it, all right? Because it's going to reduce your chance of being put into the hospital and dying of this. Be patient, listen, study, don't rush to it, because by fall we're going to have a little better idea of what's coming up out of the path and which one. Probably about next year at this time, we're going to have a little better idea. Do we all need boosters again? So vaccinations for COVID are going to be a process. It's going to be with us. It's going to be an ongoing process. It's probably going to be with us for years to come as we're studying whether we have immunity or not. You're going to need a blood test to eventually tell you whether it's working for you, because I don't know if it's working for me or not. I don't know how well it took for me. I know what the data shows, but eventually I'm going to need some blood work. So what I'm trying to then say is, people, even if you have it, still be safe, still be considerate, still wear your mask, still socially distance, and just be cognizant of your neighbor. And then my final point about vaccines is that we need the world to get vaccinated. Okay. We can't, we're great, we're taking care of ourselves and our neighbors and our family, but otherwise we have to become citizens of the world. We have to allow the third world countries to get vaccinated just as well as we are. We have to get it to every person, not only like right now, my team is, and I just came back from Arizona, we're doing vaccinations in Southern Arizona on the borders. We're going into homes, we're going into reservations, we're going into places like that. But we're going to have to find ways to go into the tips of South America and the tips of Africa as a world, as a civilized world, because how do mutations occur? Mutations are going to occur when we're going to let this virus sit and circulate in areas unchecked and get into the wrong people and spread into the wrong village. And then we start all over again. So people have to, be cognizant that there's a bigger picture before this will totally go away. And it's just not get my shot and say I'm done. So I'm sorry, that was my little need to make sure we think as broader citizens of our state and broader citizens of our country and the world, and along back to our homes. You got to get into every corner of Kauai. You got to find people living way off the grid, and you got to find people who are less fortunate and have less income and may not be educated, or maybe paranoid of the government. We need all of them to get vaccinated to save them. So,
right now we definitely having a problem, and we talked about, Mel and I talked about this the other night, and that is um, that because the vaccine is rolled out, it's the big hope, right? And there's some reports that says that this vaccine should last a couple years, and then but nobody really knows the full extent of it because the jury is still out on it. But people are already making that complacent judgment that, okay, we vaccinated, so because the question that pops up all the time is, can you transmit if you were to get the virus even though you've been vaccinated? You won't show the symptoms because you basically asymptomatic, right? But then
right.
can you be able to transmit the virus? That's the part that the jury is still out. So of course these for lack of well, better term, uh, these knuckleheads just they're just gonna try to chance them and say, hey, no worry, I'm okay. I don't know about you, and then bingo, that the kicking the can down the road starts all over again. You know what I'm saying? It's just gonna keep on rolling over, rolling over, rolling over. What message do you think the government needs to do that with everything possible until, I would, for me, I would just like to say, until we have no island showing any numbers, then we can say for sure, yep, it's done.
Yeah.
But, you know, Kauai with zero, but yet that's not to say tomorrow won't get one, but yet we're very low. Honolulu is constant between 50 and 80. They just constant right across the board for some reason. And Maui, now they're constant between 10 and 20. Sometimes they'll go outside of the 20 mark. Most times they'll stay between about 15, right in that range. Big Island now is about between 3 and 5. That's what's been popping up on the reports. So the question is, how do we get the message out, Doc?
Well, you guys are doing a great job of it, and what we need to do is to probably have less political speak and more,
Hey,
more truth, right? More truth, and And that's kind of always been what I've been trying to do when I'm given a chance. I don't seek to be in front of TV cameras or microphones, but you know what? After a while, I started to step up and accept it, because it would just piss me off when I just be listening to these people, and I'm like, why don't you tell people the truth? Why are you talking out of the sides? And it just doesn't make any sense. And I'll give you a quick analogy that people have told me makes a lot of sense to them, when you're trying to visualize, well, what happens? Okay, I gave this, you guys tell me if this works. I don't think I told you on this show. We've all hopefully seen what it looks like when you take a few little crumbs of yeast and you're making some bread, or you're making some really good something there, and you put some, whether it's water, warm water, sugar, whatever you're doing, you throw it in there and you're letting it kick, and man, you come back and those little wee crumbs of yeast are just kind of filling up and bubbling up, and then you can start throwing whatever in to make your bread. Or me, it's pizza dough here at our house. Well, okay, think about that analogy for this little COVID. So those little crumbs are the virus, and they get up into your nose, right? Or they get into the back of your throat. And man, they're rapidly reproducing. That's what we know about this thing. And so those things get up there, and they're in your skin, and they're in the mucus, and they're in the soft tissue, which is a great place for them to breathe, to spread, just like your yeast does with the water. All right, so they're spreading. But what's the difference? Now, normally, if you didn't have a vaccine, they then puncture the skin, they get into the cells, they start injecting their little viral particles in there. And then eventually those little viral particles get in your bloodstream, and they start spreading, and they get into your lungs, and they're breeding. Well, now take your little yeast particles, they're spreading in your mouth and nose. They're still going because it's a great environment. But the vaccine has sent the Marines and your SEAL forces, and then the Army behind it, to be right at the barrier, so that even though they're spreading in your soft tissue mucosa and things like that, they're not penetrating, getting into your system. They're stopping it from fighting. That's what those antibodies do. So that's where you need to be thinking about it. Wait a second, it can jump up into my nose. It can start replicating maybe in my mucus and things like that, or my back of my throat, but it's not diving in to make me sick and put me into the intensive care unit. So technically, if it's in a day or so, I could be coughing and spewing it on to my friends. It's not getting me sick, but I could get my friends sick with it, because it's not going away completely. Eventually it will die out. Some people were worried could be carriers, just like if you've ever had a family with strep throat. Sometimes if it keeps spreading, we bring everybody in and we swab their nose, because we find one person's carrying it. They don't get sick, but it's just living up in their nose. Same thing with things like MRSA, the bad bacterial infection. It can live in different areas, and the nose is a special medium to do it. So that's a little bit long-winded, but it's something that I hope people visualize, understand, is why you need to be careful. Still wear your mask, because you could spread it but not get sick with it.
And we have been preaching that for a long time. Again, from when Dr. Kim was first on our show, before the vaccines had been released, before it had been approved for emergency use, and subsequent to that, he came back on the show and talked about, and he made it very clear that the trials that were done did not address the vaccine as it relates to being able to contract the virus, just as you just mentioned, and Charlie said about being asymptomatic and being able to spread. And that still holds true today. And again, I just, this show, we just open and we straight, and I'll be straight. Our viewers and many others will watch the morning news and hear from the Lieutenant Governor that 14 days after your second shot, you have sterilization immunity. And that's simply not true, Doc. And I think as we try our best to get the info out from the experts and all of that, there's mixed messages being sent from the legislature, from the executive branch, because for whatever reason, maybe they want to create a chaotic environment. I'm not sure, but there's not one person that we can find that will agree that in fact you'll be immune after the second shot. That doesn't exist.
Yeah, no, we don't know. That's what I just said. We do not have an understanding of how long the immunity will last and how much my immunity is set versus yours versus Charlie's. We don't know that. We don't know that. What we all agree with medically is the chances of lethality, of severe hospitalization are likely decreased from what we have. That's probably about the one common thing that we all agree with, right? Now, let me throw something else out, which is, this is another one of those global things, like when we talked about South Korea. Okay, what do we do? We have this balance of trying to have some degree of normality going on in the world. And I think that there is some question about whether do we exempt people from having all the testing that it needs to be done by virtue of having two vaccines. There are countries now that are opening up with the quote unquote vaccine passport to say if you've got the vaccine, you can come in. I actually, as of the last 4 or 5 days ago, I was contacted to advise the NHL and jumping in full feet first because they just have had a big outbreak that's been spreading and shut some games down. And so they turned to my work in the SEC, which, I guess is starting to spread that we had the best season of all the major sports and kept it down by virtue of our testing programs. I'm talking with them, and at the same time, it's a two thing where they're also talking about opening back up to fans. And I'm like, whoa, okay. But on the other hand, one of the things that I would question and say that if you're going to still have a socially distanced arena, and say, I was thinking already, someone was asking me about graduations here, as graduations are being important. If people had vaccines, would that be something where we could start having some degree of lessening of the ability for them to get into a public space? And if I sit here right now, I have to think about it, but my first gut is, from a medical safety standpoint, I would feel a little bit better that that a group of people with vaccines was safer to have in a common area. Now, I'm not talking within 6 feet, but I'm saying within an area. So I'm bringing this up, guys, because there's going to be broader discussions that are going to occur on the basis of vaccination safety or not. We're going to have more information as time goes on to know actually how safe it is. I would guess that we're going to have blood tests to prove how much your immunity is present to say how safe it is. And eventually we do want more people to get the vaccine if it is safe, as we know it is, to get herd immunity to decrease the chances that other people are going to get it. So I don't know. What do you guys think? What do you think? Should we allow the vaccination to give you maybe an opportunity to go places that other people don't? It's a ethical, moral, medical conundrum. What do you think?
Well,
I think, like the governor said today, I would agree with the governor that he's not going to approve anything until we get the science, because I think it's just too risky, especially now with the variant and the contagiousness of this new variants, that you only need one, and in a gathering you only need one, and especially if it's a close, if it's a wedding or a graduation or anything like that. So I think I don't know how long before those tests are completed to find out whether or not you can still transmit the virus after the vaccine. But for me, I think you wait and not take a chance.
So you guys are on the wait side. What is the science that you would want to hear to allow you to feel a little bit better, to put your family into that setting, or to open up the island to it? What is the science that you guys want to hear to do that? I'm asking this because there is no right answer to this, but I really respect you guys and your thought leaders. And I'm really interested to understand, what is it that we're shooting for as the world? What is the honest answer that someone in the know has to look at you and tell you to make you feel better?
Well, when you got noted expert like is it Hostes or even Kim or Gunder, all those highly touted individuals that just really looking really hard. I would think that from the medical community, the science, on the science end of it, if they came across and just said, we pretty got convincing data that would suggest this, then I think at that point I would feel pretty darn safe. But what's making it hard, just me personally, and I'm speaking for Mel, but just for me and others who have contacted me, I'm like you, I don't know what the answer is. But yet, when they hear our state officials making a comment, it sounds so nonchalant. It's not really a thought process that went into it. It's just like, I'm confident this. Well, we want to run with it, and yet people ask us, hey, the next guest you get on, ask them. Or like we asked Kim, we sent Kim. I said, hey, Doc, what do you think about this? And even he says, in all the different um, vaccine companies that he's been in contact with and asking them, even they've said that right now it's just not enough data because number one, when the EUA was approved, they went strictly in this format.
Yeah.
What they should have done, and he says maybe what they should have done, thinking back then, we should have asked, hey, in our clinical trials, we should be also be looking at is whether or not these individuals can get the virus and they can transmit the virus. But we weren't tasked with that. That's why we cannot answer or ask that question
Yep.
because we only have EUA on this. And at that point, that's when the thing clicked that said, okay, now I understand because for a lay person, we would just be thinking, it's just so easy just to ask a darn question. Well, it just doesn't work that way in that business realm when you ask for an EUA. So Doc, I tell you the truth, if you got some big heavy hitters that are science based that are around the country that because it for some reason um, even Fauci had come across and said, he doesn't know yet. That it's still too early to tell. And
Yeah.
here you got, one of the most respected individuals, and yet our elected officials, they just go and answer just like that. And that's why it's causing this division right now. It's just, hey, you got Fauci, who has decades of the experience that he has, and then you're making a call. And I understand about the economy. I understand that wholeheartedly. But I always think, there's a better way we can do messaging. So, because what you're really asking for, Doc, is what can the people of Hawaii buy into? You have to buy into something that's sound. And right now, everybody is like, I don't know what's sound because we're hearing everything from, a pie in the sky to a blue man walking on a moon or something. It's just right now we don't know. We know the basics, what we've heard from you, what we've heard from other experts we brought on, what we've heard from what we've seen on a lot of the nationally syndicated programs. We've talked to Dr. Kim about. We've heard it, and so we accept that. Me personally, I accept what you say, but until there's a consensus amongst all the experts and says yes, we've all looked at it. It's just like peer review, right?
Yeah, sure.
These guys do the thing and says, yeah, bingo, you've got it now.
Well, guys, I understand what you're saying. And, I think the message really is to all of our listeners and to the people of our state and the country is that, number one, if I had to summarize, get your vaccine. Don't be afraid of it. Get it because we know it can really help make a huge difference. Watch, listen to the data, listen to what's going on. And that's what you guys are saying. And that's what I've been saying, just because you've had the vaccine, don't stop, don't give up, don't stop social distancing, still worry about your family, still be concerned if you get some kind of illness that you don't know what it is, because we don't know, right? We don't know. And we are going to know. We're going to know in 3 to 6 months of what's going to happen. Now, I'll throw from my perspective as a guy who's lived my life for this and studied the science. I will feel pretty good if I'm in a room full of people from Hawaii that have all had two shots. I think the transmissibility is going to be highly unlikely, but I don't know for sure. I just don't know for sure. And so that's why I'm going to take every precaution. I'm still wearing my N95, not just my plain mask, and I'm going to do everything I can do. So, and again, for the people of our state, hold on. We're doing better than anybody in the country. So whatever's happening, keep it up. And the fact is that we are going to get through this as a country. We're going to get through this probably faster than any state as Hawaii. So we're in a good position. Our country will get through this. The world will get through this. We're going to make it. But this is, so many people have this myth that, summer, everything's going to be good by summer. No, come on, man. We're going to be hanging out, Mel, your beard's going to be a little more gray, so Charlie, your beard might start growing. So,
I'm gonna start looking older, yeah, for sure.
no, man, you're looking younger every time I see you. Every time I see you, man, you're looking good. You're looking younger. Yeah, that's one thing. COVID's fountain of youth. When you're sitting here fighting it all the time and you can't go out and you can't do anything, we're all getting younger. So yeah, no, I don't feel younger. I did about 8 hours of yard work of planting and trimming yesterday. I used muscles I haven't been using fighting COVID in the yard yesterday. Holy cow.
I know how that goes, man. That's bizarre.
Yeah. But yeah, guys, we're gonna be hanging out as long as you keep inviting me back, because there are going to be twists and turns. And again, the twists and turns are going to be in the vaccines and the winners and losers that are going to come out. They're going to be twists and turns in the variants and how rapidly the variant spreads. And if it does cause most of us are believing we're going to have another spring peak due to variants in the mainland. Okay. So just expect that there may be another spring peak. And if we don't do the right thing, then we're going to go back through that graduation, May, 4th of July, and we're going to have that next little bump up. We don't want to see that. We can stop that in our state. And then, we're going to be trying to get, my days are zoomed everywhere, or if I'm not on the mainland. And right now my group is, we're going to be probably assisting in rural areas of California to get the vaccine out, because they just can't do the logistics to get it out. And I have people all over, because we know how to do that. And there's so many challenges across our country to get 330 some million people vaccinated. It's just going to be incredible this year trying to do it. We haven't even scratched the surface. And Hawaii, we still got to get it out into the corners of our island. So we're going to be better than most, but we got a lot of work to do yet.
Yes, we do. I appreciate tonight again, Doc. I know we went a little overtime, and I have another Zoom meeting at 8:30. But Charlie.
Well, again, I'd like to say thanks a lot, Doc. It's always great to have you on. Thank you for spreading your knowledge with our viewers. To our viewers out there, sometimes we can arrive to an answer, and sometimes we can't. But it's always good to have a lively discussion just to see where we're at, because if we continue to ask questions, then you folks are doing something right. It's like they say, if you don't ask questions, then no grumble. If something should go haywire, ask the question. Don't be afraid, because there's no such thing as a stupid question. There is such a thing as a stupid answer when you're answering and you don't even know what the hell you're answering. That's a stupid answer. But for the most part, there is no stupid question. You ask what you need to ask. I want to say thank you to everyone I'm sorry we didn't get to all the questions that came through. There are a lot of questions, but I know the doc gets to read them too. Mel and we get to read them after. and we'll answer it then. But for the most part, like they said, stay safe because we still don't know what's over the horizon. And if we can tell you one thing now, but if the variant comes and say it just drops off the face of the earth, then hey, happy us, right? But if
Mhm.
it doesn't, then we better hold on tight because we're gonna be in for a ride. Okay, so
Yeah.
just wear your mask and do the rest of the things that we've always been asking you to do. Okay, thanks, Mel.
Thank you, Charlie. Thank you, Doc. Again, like I said earlier, Dr. Miscovich has been in the front from day one. He's seen it all. We appreciate you spending the time with us and going a little overtime. Always appreciate your input. Bottom line is this: vaccine is critical. He's got to get the vaccine. But if we all remember, we started saying this a year ago. If we all assume that we have the virus and we assume that everyone else has the virus, no one's going to get sick because you're going to stay away. You're going to wear your mask. You're going to go wash your hands. You're not going to go to gatherings and functions. But no, we are our own worst enemies. Super Bowl is a great example. So people, we gotta be smart about this, and we gotta learn and listen to the facts and the evidence and the truth, and that's what we try to do on this show, and be safe, and hope that our decision makers make decisions that keep us safe based on science. And I'm after hearing the governor today, I think that's the direction they're taking, and I'm happy for that. But that doesn't take away the fact that we got to be responsible people as well. And we need to do what it takes to stay safe and keep everyone else safe. That's just our law of spirit. That's just what we do. So, Doc, thanks again. Appreciate your time. We'll definitely get you back on. This stuff changes so quick, my Lord. We'll get you back on. And you want to say something? I can see you like.
Well, yeah, no, one of these times I want to, yeah, I'll come back on and maybe we'll talk something's fun because I'm invited. I'm going to be on site for the SEC men's and women's and March Madness because we're doing a lot of the testing for all of those tournaments and all kind of sporting events and there's this balance of we're trying to keep the world open because the things that allow us to have a little bit of downturn as a human, as an American, we need to have those. And so I'm working hard to keep those coming to America. And we're doing Disney, keeping the films going. And I've got some crazy great projects that they've been asking us to come from rural Arizona to rural California. And so maybe sometime we'll get on and we'll talk about just kind of the view from America, what's going on in America, because we're lucky. That's why I have more of a hint of optimism today, guys, because I've been to some really, really dark places and where there's no optimism and there's no hope and the hospitals are full and everybody's first degree of separation is someone's died that they know of. And I know, Charlie, you've had that, but the fact is that having been all over the country, especially through the southern US and southwestern US, where it's been very challenging, we have some things to be happy about as a state and as a people. So keep it up, Hawaii.
Roger Dodger. All right, everybody. Again, thank you. Sorry for getting a little bit late. We'll be catch you guys tomorrow night at 7 o'clock again. Same place, same time. You guys stay safe. We love you guys. God bless. Take care.
See you guys. Take care.
Aloha.
Bye. Aloha. Bye.